Okay, question number 1. Is it easy to use the Medit Splints app? I know other companies also have Splint apps, but what are the advantages or distinctive features of Medit Splints app?
Oh, that's a really good question because nowadays we have lots of companies, lots of softwares out there. I've used many, Jenny, if I'm honest. I've used a few of them.
Yeah.
What I can say about Medit is the first thing I could say is simplicity. It's very simple to use, very user-friendly. It gives you the opportunity. You don't need to be really good with computers. You don't need to be a really good technician in dentistry to be able to use this software. So I think anyone could use them, even dentists, nurses, receptionists can use them because at the end of the day, it's a really easy workflow. That's a good advantage. Another advantage with this, and I think AI is taking over in our life. There's going to be big congress about AI really soon, and if there are any, there should be anytime soon. It's 2024, and AI, the feature that Medit has with the AI, it's quite advanced compared to others. With one click, you can have nearly the whole splint done. So that's a big advantage as well. And then I could also say that it's an open software. And if you have any other scanners, you can use Medit as well. That's why it's really good. I think it does help a lot. You don't have many limitations with it.
Is there any special or specific function that you like the most in the Splint app?
So there is one, and as I say, it's the AI function. AI. So when you click on a button, straight away you can have the splint done. It's literally 10, 15 seconds what it takes.
Yeah.
Where most of the companies you need to go through all the steps.
Yeah.
And the more the AI is advanced, the more it learns with it. We're going to have our own kind of likes of splints really, really, really soon.
Okay, thank you. Okay, let's move on to the question number 2. What is the most effective way of diagnosing TMD?
That's a quite broad question.
Yeah.
When it comes to TMD, and we haven't spoke much about it in the webinar, when it comes to TMD, is another full topic concerning how to diagnose TMD. The first thing that I'll ask the patient, the first thing that I'll try to do is ask the patient for symptoms, for signs, anything that the patient might feel. That's going to give me some pieces of information. Then imaging is really important. We need to either take some x-rays, we can take some MRIs as well, but sometimes it's not that easy to find somewhere to take an MRI. So the last thing that we can do, and I can show you how to do it, is with a load test. So we need to load the joint. We need to see if there is any pain coming from it with some pressure when we apply some pressure. So it's a combination of things. It's never just one thing is going to give you exactly the diagnosis. But then thanks to one of those features, you'll be able to find if the patient has TMD or not.
Okay, it means it's a combination of all the symptoms.
Yeah.
Okay, question number 3. Has there been any case where it took a very long time to relieve TMD or where TMD couldn't be relieved?
So sometimes, again, it's a big topic. But yes, there is patients. I have patients where in a few hours, a few days, the patient can have can be symptom free because that TMD can come either from muscles, but also it can come from 10 other places. I mean, 10 other different places. It's not only the pain coming from the joint, but sometimes it's also the differential diagnosis of TMD can be a nerve, can be something what we call more a psychological kind of pattern. It's not only there is a pain in the joint or in the muscles, it can be a combination of things. And I had patients where it took me either from a few hours to a few days to up to 6 months. And also there are cases where I can't really help the patient. So in dentistry, we can help some of the patients, but not all of them. Some of those problems may come from somewhere else. They might come from the neck. They might come from the brain. If they come from the mouth, we can help them, definitely. But if it
Yeah.
doesn't, then we're very limited.
I see. Okay. Question number 4. Is TMD more related to masticatory muscles or is it primarily caused by occlusion?
The patient is different on the patient. Some patients trigger very easily. Some patients, they don't trigger. So we have the ability to adapt as human beings, to adapt really well. Some patients, once you kind of have them on a splint, they improve massively, very easily. Where others, they can take quite a long time. And some others, they might not be able to improve at all. So it's not only an occlusal part of it, it's a combination of things, as I said. So
Yeah.
the patient, if it's occlusal, they're going to improve very easily. But if it's not occlusal or not muscular or not related to the joint itself, which is the bit up here, then we won't be able to see any improvements.
I see. But in that case, splits helps.
Splint, they can help, but they definitely won't solve the problem. So I do have patients sometimes that they might be in a 9 out of 10 in pain. So you ask them, are you in a lot of pain? They are in a lot of pain. And they can come to a 7 to a 6. But when it comes to those very difficult patients, as I said, it's more like a psychosocial part of this. It's not only treating the disease itself, but also everything that's behind. So the patient might be on some other problems in their lives as well.
I see. Okay. Question number 5. Do you think is airway essential when designing splints?
That's a really good question, and I think it's really important. I could say it's essential, definitely, because when we place some sort of splint, we're going to relax our muscles. If we have any airway pressure here, so our muscles, if we do have any airway pressure, again, that's another topic that we can talk about. All the muscles are in our neck, they're going to relax and they can compress the rest of the neck. So if we're trying to sleep, we can have some sort of sleeping apnea where we stop breathing, where we can't really take enough air. So if we don't take enough air, we can stop breathing. We can have so many other problems that come with not being able to oxygenate our brain or the rest of our body as well. But definitely, if we place some sort of splint and we relax the patient muscle, we need to really monitor the patient's symptoms and we need to see, is the patient okay with the splint? The thing is, in Spain, what I tend to see very often is we give the patient a splint and then off you go. You can go home with the splint. I'll see you next year. So we can't really do that because if we do relax the patient and the airway can affect, and he can have some sort of sleeping apnea, we need to monitor, we need to check that the patient is doing okay. Also, there are some devices where they're going to advance the jaw. So splints can help as well with breathing problems if we do advance the jaw. But the splint that I was talking about, and is only one kind of splint that we talked in the webinar, is the full coverage splint. Those kind of splints, they're going to relax the muscle, but also the joints and everything around it. So the jaw is going to go back. If the jaw goes back, then we can have problem with the airway. So really careful with it.
Okay. So last question. Question number 6. Can you explain the workflow of deprogramming and reprogramming?
Yeah, it's a big workflow, and to see how to reprogram or program a patient, deprogram or reprogram, we need to see everything as a whole. So it is true the splints, they can deprogram the patient, they can set him in a position where than it used to be, because the patient used to be in one position only. So the patient is only positioned with the jaw in a position where the teeth touches each other. So if we remove that factor and teeth are not touching each other anymore, but we have a piece of plastic in between, then the patient is going to be deprogrammed. Then if we remove that piece of plastic, the patient is going to reprogram itself. But what we are trying as dentists to do is to reprogram them in a position where we feel confident enough, where we feel comfortable as well. Say we're going to play some restorations, say we're going to do some orthodontics. With all of those things considered, then we need to see, where do we want the patient to bite? And at the end of the day, what we're trying to have is some sort of reference point. Once we have that reference point, then we can work around that.
So how long does it take when doing deprogramming and reprogramming? Which one is faster, or how long, real months, it takes?
So deprogramming can, some patients is different. It differs on the patient. So if the patient is really easy to deprogram, in 5 minutes the patient can be deprogrammed.
5
Then
minutes?
the reprogramming normally takes a bit longer, because you can ask the patients to be kind of relaxed quite easily. Some patients, they do take longer. But if they deprogram themselves really quickly, once you tell them, okay, just go back where you were, they kind of don't really know where they were. So they need to allow the body to reprogram itself. And it normally takes them at least 24 hours. In 24 hours, they kind of reprogram themselves to be in the position where they used to be. I do see patients as well. They wear the splints at nighttime. They wake up, they are deprogrammed, and then when they're going to go and have breakfast, they are already reprogrammed again. So some patients, it depends on the patient. Some people take longer, some patients take less time.
Okay. So
But it's a really good topic, and it's really wide, and we can talk about an hour about it if we wanted to.
Yeah, so it would be really great if you can deal with this topic later on with the next webinar.
No problem. We'll definitely do it.
Okay, so it was all about it for today.
Thank you very much, Jenny. Thank you for all the present people watching the webinar.
We were so happy to have you here today. So, okay, so we'll see you next time.
Thank you very much, Jenny.
Okay, so you'll be able to watch this webinar on our YouTube channel and Medit Academy once it's completed. Thank you for being here, Dr. Hector.
Thank you. Bye.
Bye-bye.